It's important for us to focus on the HIV epidemic in the South because the South is the epicenter of the epidemic in the United States. Year after year, more people are diagnosed with HIV in the South than the rest of the country combined. Today, we are home to the most people living with and dying from the epidemic, including the most men, women, and people of color. We live in a very exciting time where we're talking about the end of an epidemic. Treatment advances have transformed what was once a fatal diagnosis into a chronic condition for so many of our brothers and sisters. We have new medications that allow us to prevent the transmission of the disease for people who are not living with HIV. But let's be real, there's no way for us to end the epidemic unless we focus on the disparities in the South. During his State of the Union address on February 5th, 2019, President Trump announced his administration's goals to end the HIV epidemic in the United States within 10 years. The Department of Health and Human Services subsequently released Ending the HIV Epidemic, a Plan for America. In the first 5 years, the initiative will focus on 48 high-burden counties, the District of Columbia, San Juan, and 7 states with a substantial rural HIV epidemic. Notably, nearly one-half of these counties, the District of Columbia, and 6 of the 7 states are in the South. These jurisdictions represent 60% of all people living with HIV in the South. The success of the plan requires coordinated and cross-sector responses. These responses must be data-driven, relevant, and culturally appropriate to each geographic region of the country. Ultimately, to end the HIV epidemic in the South, we must look to the South for the solutions. The Southern AIDS Coalition is uniquely positioned to identify solutions in the fight against HIV/AIDS in the South. As a leader in the South for nearly 20 years, we have developed strong relationships with people living with HIV, the communities most disproportionately impacted by the epidemic, and the organizations on the front lines of serving them. We hope to leverage these relationships to identify solutions that will ensure the success of ending the HIV epidemic, a Plan for America. Southern Solutions is an opportunity for us to gather and talk about the things that are working across the South. I've been working in HIV for almost as long as the Southern AIDS Coalition has existed. And in that time, we spend most of our time talking about the things that the South doesn't have. We talk about the disparities, and we talk about the lack of resources, and we talk about all the things that fuel our epidemic. And quite frankly, I'm tired of talking about the things we don't have, and I'm tired of coming from a place of deficit. I'm ready to talk about the things that we do have, and I'm ready to talk about the solutions. So what do we have? We have brilliant people who are working in small communities all across our region to make a difference in the lives of people living with or vulnerable to HIV. Places like Cleveland, Mississippi, or Memphis, Tennessee, or Panama City Beach, Florida. We know what works. If we can figure out how to harness this power and this passion for people doing this work in these small communities and sharing those best practices across the rest of the region, we can make a difference. According to a recent study from the Southern HIV/AIDS Strategy Initiative, people living with HIV in the Deep South experience considerable HIV-related stigma. This stigma, particularly when internalized, is associated with negative health outcomes, including poor medication adherence, missed medical appointments, and a failure to achieve viral suppression. Consequently, fewer Southerners living with HIV receive timely medical care and treatment. Fewer of us have our virus suppressed, and a disproportionate number of us are missing out on the opportunity to preserve our health and avoid transmitting the virus to our partners. As a result, mortality remains alarmingly high across the South, with death rates in some southern states nearly 3 times higher than the national average. So why do I do this work? Because it's the right thing to do. The South is my home. I was born and raised in Alabama, and I am committed to staying here for as long as it takes to make sure that we end this epidemic for people living in Alabama and the rest of the South. It's also the right thing for the rest of the country to do. If we talk about ending an epidemic, we have to talk about ending it for all people. That includes people living in the South. That includes men and women of color, including gay, bisexual, and same-gender loving men. That includes our transgender men and women, and it includes our young people. Yesterday, we observed the inaugural Southern HIV/AIDS Awareness Day. This day marks a time for us to come together as a community and raise awareness of the epidemic in the South. It's also a time for us to honor all those who we've lost, a time to recognize all the men and women who are living with HIV in the South, and a time to thank those organizations who are on the front lines of serving. My hope is that today marks a new chapter for the South. A chapter where every person has access to high-quality healthcare and essential support services, free from stigma and discrimination. Also a chapter where every person knows his or her risk for HIV transmission and has access to a full range of prevention interventions and harm reduction services. Thank you for being with us today. Thank you for the hard work that you do every day, and we look forward to working with you in the days ahead.